Hello and welcome to the latest edition of WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. March is National Kidney Month and Thursday is World Kidney Day. Did you know that West Virginia has one of the highest rates of kidney failure in the country and that kidney disease is among the leading causes of death for West Virginians? Now, of the more than 113,000 people in the U.S. waiting for an organ transplant, more than 95,000 are awaiting a kidney. So today, we're talking about kidney disease and kidney transplants with Dr. Lynsey Biondi, Surgical Director of kidney transplant for the WVU Medicine Transplant Alliance. Sorry about that. We'll fix that. Welcome, Dr. Biondi.
Thank you very much. I'm glad to be here.
Now, if any of you have questions about kidney transplant or kidney disease, you can post them here in the comments section and we'll try to answer them live for you. Okay, so let's start here with kind of the basics. I mean, I just think it's so unfortunate that West Virginia has one of the highest rates of kidney failure in the country. So we're number one, right?
We are in most years number one. The rate of kidney disease in West Virginia is 4.52% of patients, which is above the national average, which is about 2.4%. So a lot of people have kidney disease.
And why do you think that is so high here in West Virginia?
I think there's a number of factors, and a lot of it goes back to obesity, high blood pressure, and diabetes, as well as smoking. All of those things affect kidney disease, and the two biggest causes of kidney failure are diabetes and high blood pressure.
Okay, so that makes sense.
Yeah.
So how many West Virginians are awaiting a transplant?
Right now, as of 2 days ago, there are 252 West Virginians on the list for a kidney transplant, which is not as high a number as I would expect. And that's one of the reasons we're here. We think there are a lot of West Virginians who need kidney transplants who are not yet listed for a transplant.
And that's the highest rate in the country, too.
Mm-hmm. Yeah, it is the highest rate.
So we may have a lot of people out there that need help and don't know it or
Right.
realize it.
Mm-hmm.
Wow. So what is the average wait time on the kidney donor list?
So to get a deceased donor kidney, which is through the national system, it's an average about 5 years, depending on your blood type. So that's a long wait.
That's long, yeah. I imagine a lot, do you have a lot of people pass before they're eligible for a kidney?
We do. Unfortunately, about 20 people die every day in this country waiting for a transplant. There just aren't enough deceased donor kidneys to go around, and it's a problem.
And that's why we're here today.
That's why we're here today.
We've got to let people know about how easy it is to donate, right?
Yep.
And it is pretty easy, isn't it?
It is. It is easy to donate. So,
first of all, when it comes to donors, are most of the donors living donors or deceased?
They're mostly deceased donors. So last year there were about 14,000 deceased donors in this country, and most of them can give 2 kidneys. There were about 6,000 living donors in this country. So a lot more deceased donors, but there's a lot more room to have living donation. That's something that we can expand as well, and it can be done safely, and it's actually better for the recipient.
Yeah, I mean, can you live a healthy life with 1 kidney, if you're a living donor?
Absolutely. A transplant recipient can live well with 1 kidney, but a donor can live an absolutely healthy life with 1 kidney. Now, not everyone can donate. If we took a kidney out of everyone, they wouldn't all live healthy lives. So there's a very big screening process. So if you come forward and say that you want to donate, you're going to have a lot of testing done.
That's okay. God bless you.
Excuse me. Mm-hmm. There's going to be a lot of testing that you're going to have to do to become a living donor, because we don't want to take a living donor, take their kidney, and then make them need a transplant, right? We want to be very careful with that. So we do a lot of screening to make sure they're not being coerced or feel pressured, but also to make sure they don't have high blood pressure or diabetes that's severe enough that it would affect their kidneys in the long term. But what we know about kidney transplant and living donors is that donating a kidney does not affect your long-term life expectancy. Living donors live just as long as everyone else.
So you're looking out for the health of both the donor and the person that's receiving the kidney.
Absolutely. That's really important to us. We actually, every transplant team and here at WVU Medicine has two separate groups of people that look at the recipient and that look at the potential donor. We even have what's called an independent living donor advocate. They're specially trained people that meet every potential donor and advocate just for their rights and their well-being to make sure that they have lots of information, their questions are answered, that they're getting the answers about their health before they donate, and that the process is right for them.
Now, as far as donating, being a deceased donor, I want to do a little myth busting here because, I've there are some people that think, well, I don't want to sign up to be a donor because, if I'm in a critical situation, are they not going to do everything they can for me so they can harvest my organ?
Oh, lots of people think that. My husband used to think that.
Oh, really?
Yes. We were married long before I was a transplant surgeon even, but as I went through that, I had to teach him too. He said, well, how do I know some sheriff in another county is not going to take one of my kidneys if someone in his family needs it, if I'm in an accident?
Yeah.
It's so not true. There's such a process of making sure that there's consent for donation if you've died. But actually, deceased donors get more care than someone who doesn't donate because you have to have either been brain dead or have basically a fatal injury. But then the people taking care of you have to keep taking care of you to keep your organs functioning well. So you actually end up with more care if you're a donor at the end of your life than anyone else does. It's not something that happens quickly. There's lots of checks and balances on that. So you actually are going to get the best care if you're a donor.
Well, that's good to know. That's good to know. Okay, so we want to talk about organ donation.
Absolutely.
How easy is it to become an organ donor?
So anyone can register to be an organ donor, and I encourage everyone to talk to their family if they're thinking about it. Let them know that you're thinking about donating an organ. You can register online through the WVU website. If you go to registerme.com/WVU, we'll put that up for you. And it's a few clicks of a button. The other thing you can do is when you go get your driver's license, you can fill out a form there, and easy way. And then West Virginia actually was the first state in the country to allow you to register to be a donor when you get a hunting or fishing license.
Oh, wow.
So if you go get your hunting or fishing license, you can register to be a donor as well.
So that there's a lot of different options here, right?
Mm-hmm. Absolutely.
So can you be too old to be a donor?
People always ask me that, and no, not everyone is going to donate every organ, but we actually last year in this country, there was a West Virginian who was the oldest person to donate an organ at the end of their life. It was a 95-year-old veteran.
Oh, my goodness.
And when he died, he was an organ donor, and his liver actually went to someone in Florida, and they're doing well. So 95 years old, and he gave the gift of life to someone at the end of his life.
Now, you mentioned before that if you are going to be an organ donor, you should discuss that with your family because, I'm registered to be an organ donor through my driver's license. And I have talked to my family about it. But say I didn't, if I hadn't, and even though it's on my driver's license that I want to be an organ donor and I pass, can my family members, if they think, no, we don't want to do that, can they overrule me?
So, there's a lot of legality with that, and technically in most states, your driver's license or your consent before you died actually stands, but no one really wants to argue with your loved ones.
Yeah.
So, if they're really saying they don't want you to donate, you might not end up being a donor. So it's important to talk to your family so there's not that. If for some reason something happens, that they're aware of your wishes so that it's not stressful to them at the end of your life.
Yeah, because that's so hard anyway,
Yeah.
You don't need one more thing.
Right. No, we hate that people have to become donors, but it's a way to make something good out of a bad situation, and so we want it to be as smooth as possible.
Yeah, I mean, how many? Well, if it's just obviously it's one person. If it's a kidney donation, but when you're an organ donor, like you can save
Many
many
lives.
lives.
So multiple organs as well as tissue donations as well to save and enhance lives.
Yeah. What kind of tissue can you also donate?
So there can be tissue for skin grafts, there can be corneas, there can be
Yeah.
tissue for orthopedic surgeries, that kind of thing as well. So
That's great. It's like recycling, really.
it is in the best possible way.
Yeah,
absolutely.
definitely. With kidney disease being among the leading causes of death for West Virginians, another thing we're number one in. We really shouldn't be, but what causes kidney disease, and what can we do to prevent it?
So that's so important, especially in this state. We do have too much kidney disease, and some kidney diseases can't be helped. There are genetic kidney diseases that there's nothing you can do about it. But the most common causes are actually preventable or modifiable, at least. So high blood pressure and diabetes. So a simple thing people can do is get their blood pressure checked every year. You can do that when you walk into a drugstore with one of those machines, and if it tells you you're abnormal, you probably should talk to a doctor.
Yeah.
If you know you have high blood pressure, it's important to take your medication. Same thing with diabetes, to watch your blood sugars, to stay following with your physician. Those things make a big difference. And then, it's the simple things, eating healthy and moving, trying to maintain a healthy lifestyle. It's so easy for all of us, especially in the winter, to get sitting still a lot. And we just need to get out and move and take care of ourselves and follow up.
Definitely.
Yeah.
So those two conditions, I mean, anything that strains makes your kidneys work harder.
Mm-hmm. And those things damage your kidney and the blood vessels, and that's why we see so much of it. The last thing would be to stop smoking. Tobacco and nicotine are
Something else we're number one in.
Yeah, and unfortunately that really plays with the high blood pressure and diabetes and makes it progress faster. So it's really important to stop smoking, even though it's a hard thing. And there's a lot of ways to help. There are a lot of things that are out there to help you quit smoking if you talk to your primary care doctor or you look on the website. There's for WVU Medicine, there are some
free programs.
Yeah.
Yeah. Okay. So when you do have kidney disease, what is the treatment?
So at first, you may just need medications, dietary modifications, monitoring things like your high blood pressure and diabetes, trying to prevent it from progressing. But if it progresses to the point you have end-stage renal disease, so your kidneys stop functioning enough to support your life, then you have two options. One is dialysis, which is basically having your blood filtered for you. It doesn't do all the jobs of the kidney, but it takes out the toxins. That's a big commitment, and it's life-saving because you can live, but it's life-limiting as well. It's a lot of time. Most people feel very tired and fatigued on it, so it's not the ideal lifestyle. Many people sit hooked to a machine 4 hours a day for 3 days a week, so that's a lot.
And it's not just for an hour.
It's several 4 hours a day. So that really limits your ability to do everything you want in your life. Most people are tired. A lot of people end up not working or working less. So there's a lot of impact on your life and your family. So, but obviously you want to do it if you have kidney disease. The very best treatment option for most people is a transplant. So whether it's a deceased donor transplant or a living donor transplant, someone giving you a kidney, that's the best option. Compared with dialysis, people who get a transplant will live longer and they'll feel better. So you can stand to live a normal life. You have to take medications and see your doctor, but you don't get hooked to a machine on when you have a transplant. You can travel, you can work, you can really live a normal, healthy life.
Yeah. Does it really make any difference as far as like lifespan if you get a kidney from a living donor or a deceased person?
It does. So living donor kidneys last longer and work better than deceased donor kidneys. They are the best. If you need a transplant, that's the best kind of kidney to get. Wow. Absolutely.
So what can we do to let's give the big pitch here.
Yes.
What can
Yes.
you know? What can we do to encourage more people to be living donors?
So I think it's really important to know it's an option. Most people, I think, don't know that they could give a kidney and do it safely and not hurt the rest of their life. You know, we're gonna make sure you're the right candidate if you come to WVU Medicine or to any other
Sure.
hospital. We're gonna make sure you're safe to go ahead. But long term, it doesn't affect your life expectancy. There are some risks of kidney failure. I can't promise you that you wouldn't have an accident and lose your other kidney someday, but the rates of having a problem long term are very low. And what I found is that most donors are really happy that they've donated.
Yeah.
They see what they do in someone else's life. It's a gift, and most of them really reap the rewards. If it's a family member, they're seeing their spouse or their child or their cousin get back to a real life and have more time with them and more quality time. So donors really, while they're not getting a medical benefit, they get a lot of emotional benefit
Oh, yeah.
from that.
I would think so. Yeah.
So I would say to anybody who's interested or wants to know about that, find out. You don't have to be related to your recipient. So if you just want to
Okay.
donate a kidney to help somebody, one of these 90,000 people waiting for a kidney in this country, you can be a donor. We can work you up and you can donate to someone on the list and
Wow.
save their life. Let them live a normal life. So,
Wow.
yeah.
So for everybody that's watching right now, before we go, I want to know what's the most important thing you want them to know about kidney transplants?
I think the most important thing is that kidney transplant gets people back to a real quality of life and a healthy life. And so if you have kidney failure, pursue the option because you may have the chance to live a much better, longer life if you get transplanted. And put the word out there for living donors. I mean, it's hard to ask, right? Who wants to ask somebody for their kidney? That feels like a big thing.
Yeah.
But it's important for people to ask or to at least talk about it because if you don't talk about it, no one's going to know that living donation is an option. So, spread the news.
And let's go over one more time. 3 ways to become a donor.
Yes, 3 ways to come. Register me/WVU Medicine. That's the first one, online. The second one is with the driver's license, just when you go get your driver's license renewal. And the third is if you're getting a hunting or fishing license, you can sign up then.
Can't get more convenient than that,
No,
right?
you can't. Not at all.
Well, this has been really interesting. Thank you. Thank you for sharing all this good information with us. And
My pleasure.
I
Thank you
hope
for
we
having me.
I hope we get a lot of donors.
I hope so too.
I really do.
Thank you.
Well, that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about kidney transplants, visit wvumedicine.org/transplants. And we encourage you to register to become an organ donor by visiting registerme.org/WVUmedicine. Now be sure to join us for Tuesday Talks on April 12th when our topic will be heart transplants. I'm Mary Ravazio Menard, and on behalf of Dr. Biondi and everyone at WVU Medicine, thanks for joining us and have a great day.